I went to see my ENT doctor downtown, Methodist downtown, and he said, since you're a former smoker, he said, I'm going to go ahead and order a CT scan. And the CT, it picked up about a 1-inch nodule on the top part of my right lung. I smoked off and on for many, many years. I mean, smoking was in our family. My dad smoked. He also died of lung cancer.
Lung cancer is a silent killer. 3/4 of the time, we don't find it before it causes symptoms.
My experience at Houston Methodist in the lung clinic at Willowbrook is phenomenal. It was all very quick, very efficient, and a lot to absorb in a short period of time. The initial appointment was with Dr. Honeycutt, with Dr. Shaheen, and I believe Dr. Olson. And I also met Sandra Alverson, the nurse navigator, who's also been phenomenal. I mean, I could not have done this process with as much ease as I have without her guidance.
We've gone out and been aggressive about finding lung nodules and defining them as lung cancers at a stage that we can actually do something about that. By doing so, we've shifted our curve from about 25% operable lung cancers to over 50% operable lung cancers.
I had 0 symptoms. I mean, like 0. But as soon as I found out about that nodule, and again, with the family history, I thought, I want this thing out now.
We put together a program that involves pulmonologists, interventional radiologists, oncologists.
The way it was explained to me from the beginning is that it would be a robotic procedure. When they did the biopsy, they implanted a little chip, which it's my understanding that would help the robot. The recovery time using a robotic procedure is light years, months and months removed. So instead of a 6-month recovery time, it's only been a month, and I'm fairly functional. The technology is a blessing for patients.
Really what we have is a team of people who made her feel comfortable throughout the process and follow up with her immediately afterwards. She's commented many times that she felt like she was part of a comprehensive program that made her feel good about going through this whole process. It's a frightening process. I have a cancer diagnosis. It's frightening.
The next day, I started walking, getting up out of bed and walking a couple, 2-3 times a day was the best thing that happened to me. Being able to get up and walk was my passport to normalcy.
So the purpose of that walk is not necessarily for you to break any records, although it sounds like you did. When you can walk that far, when you can walk 2,000, 3,000 feet, there's nothing you can't do at home.
I feel that I need to pay it forward. And the way I can do that is to talk to friends that are ex-smokers, current smokers, whatever, and try to get them to do the low-dose CT scan, kind of like you do your mammogram every year. Same thing.
It's collaborative. It's the patient being willing to be proactive, the healthcare team getting together and being willing to collaborate, and that's medicine. That's the way medicine has been headed, and it really requires patient engagement. So the most important thing you can get from a patient is someone who's proactive and wants to chase down these diagnoses with us.
Treats.
Treats.
In case you don't have time to eat before you go to the OR. Put one out.
These are healthy.
Yeah, they are.
You're actually looking after me.
Yes.
You want to keep them out. That's good. That's good news.
I've always held Houston Methodist in very high regard, and Houston Methodist has an excellent corporate culture, and it shows. And I don't feel like that's something you can fake. On a scale of 1 to 10, with 10 being high, it was an 11.